The surgical technologist. Responsibilities: the surgical technologist works independently in most duties but is supervised in others. Supervision is necessary in the event that a task is assigned, or if the surgical technologist is a student. Apart from these two instances, the surgical technologist will work without supervision. Proper attitude: the surgical technologist should possess the following qualities in order to ensure a smooth and safe procedure for both patient and staff: care and empathy, respect for others, emotional self-control. Honesty and ethical behavior, manual dexterity, organizational skills, problem-solving skills, sense of humor. The preparation of supplies and instruments: assemble, wrap, and sterilize appropriate instrument sets. Check the case cart for completion. Gather instruments or other supplies. Station the cart in an area that has the least risk of contamination. Preparation of the operating room suite: receive necessary information regarding the equipment required for the operation. Make sure the appropriate type of operating table is in the room. Arrange tables, stands, buckets etc. as needed. Make sure all equipment is functioning properly. Receive instructions from anesthesiologist regarding the position needed for anesthesia equipment. Transporting and transferring the patient: safely transporting the patient from the floor unit to the holding area. Accompanying the circulator during his or her visit to the patient. Transporting the patient to the operating room. Providing guidance for the patient's family and friends. Performing urinary catheterization: gather supplies for catheterization. Test equipment as needed. Catheterize the patient. Provide the circulator with the appropriate information regarding catheterization. Transferring the patient to the operating room table: assist the patient in moving to the operating table. Secure the safety strap atop the patient's blanket. Take the necessary action to create a safe and comfortable environment for the patient. Surgical skin preparation and draping: gather the appropriate equipment. Position the patient with other team members. Taking the necessary precautions to protect patient from injury. Help to position drapes and ensure proper coverage of the sterile field. Drug administration: the role of the surgical technologist in handling drugs is to serve as an intermediary between the licensed nurse and the physician. The surgical technologist is responsible for the following tasks: possessing the knowledge of the name, strength, and usage of a drug, calculating the amount of drug administered, monitoring the amount and strength of every drug given to the surgeon. It is important to know the difference between a dosage, which is the regulated administration of prescribed amount of drugs, and a dose, which is the quantity of a drug to be taken at one time. The operating room team: receiving nurse, duties, greet and assess the patient and surgical site, reviews chart and verifies orders, completes a preoperative care plan, provides emotional support and pre-op teaching to the patient, communicates with the scrub nurse/technician, assists in the safe transfer of the patient from gurney to operating table, assists the anesthesiologist during anesthesia administration, receives non-sterile equipment, adjusts the surgical lights as needed, assists in the counting of sponges, needles, and instruments, maintains equipment counting during the procedure, maintains professional communication with other units, will assist in the transferring of the surgical patient to PACU. The scrub nurse/assistant, duties: assists in the sterile gowning and gloving of the surgeon, maintains a neat and sterile working field, maintains patient safety, creates and maintains a sterile field and prevents contamination, drapes the OR table from front to back, performs instrument count, identifies and receives medications, identifies and preserves specimens, anticipates the needs of the surgeon, passes instruments in an orderly manner, prepares instruments and supplies for decontamination and sterilization, ensures that sponges are counted before the first incision is made. Anesthesia care provider, duties: manage the patient's pain, maintain homeostasis, monitor and record drugs and agents administered to patient, take the necessary precautions to establish and maintain the patient's airway, respond to any surgical or anesthetic emergency. The anesthesia care provider must grant permission for the patient to be moved prior to incision. Circulator, duties: assemble needed equipment, transferring drugs onto sterile field with surgical technologist, secure surgical technologists and surgeons' gowns, perform instrument count with surgical technologist. The operating room, patient care and safety, temperature control, humidity, law and ethics, retained objects, largest cause of lawsuits, burns, falls, improper positioning, patient identity, specimen handling, medications, abandonment, civil battery, staff safety, Staph vaccinations. Hepatitis B can be transferred by needles, or a splash in the eye. Methods of protection from HIV. Safe usage of equipment within the surgical setting. Usage of proper body mechanics when transporting patients. Dangers of radiation. Dangers of laser surgery. The Health Insurance Portability and Accountability Act of 1996, HIPAA. Patient transport and transfer. Abide by the following principles when assisting in the transfer or transport of patients. Be aware of the risks of injury in order to prevent 1. X. If a patient suddenly faints, the surgical technologist should be prepared to ease the patient to the floor while protecting his/her head to prevent injury. Be sensitive to the patient's personal rights. X. Be aware of the state of the patient's garments. Each movement of the patient should be deliberate, well thought, and well planned. X. Each member participating in the transfer of a patient should be well aware of each move, and one person should be appointed to guide the others. Know your equipment. X. In the event that an unconscious patient needs to be transferred from the stretcher to the operating table, those involved should be well aware that a transfer board is needed. Positioning. Operating table. Remote control unit used by anesthesia provider to change position of table. Headboard/footboard can be flexed or moved. Arm board used when patient's arms are outstretched. It is important to avoid hyperextension when using this feature. Stirrups used to elevate and abduct the legs for access to perineal area. Headrest used in Fowler or sitting position. Braces used when patient is in the prone position to create access to the spine and back. Positioning techniques. Placement of patient's arms. Positioning of patient's neck. Positioning of patient on fracture table. Supine patient faces up with arms at side. This position is used for cardiothoracic, abdominal, face, neck, chest, shoulder, vascular, or orthopedic surgery. The head must be in good alignment with the body. Trendelenburg patient lies supine, with head lower than trunk of body. This position is used for procedures involving the pelvis. The abdominal organs come away from the pelvic region, giving greater exposure to the pelvic organs. Reverse Trendelenburg patient is almost in a standing position. This position is used for procedures of the face, neck, chest, diaphragm, or upper abdomen. Fowler's patient is seated at a 90-degree angle for surgery of the cervical spine. Sims patient lies on their side. This position is used for surgery of the kidney, uterus, or lung. Kroska jackknife patient faces down, lying on abdomen. The operating table is angled moderately or severely. This position is used for rectal, coccygeal, spinal or laminectomy procedures. Lithotomy patient's legs are raised above the pelvis. This position is used for vaginal, perineal, or rectal surgery. Dorsal recumbent is the same as supine.